Your body might be trying to send you secret signals. I'm talking about simple things, right? Like some weird cravings out of nowhere. Or maybe you notice your skin's looking a little pale. These can actually be huge clues that you're low on iron. And sometimes, believe it or not, these little clues are the first step to uncovering something way more serious, like even colon cancer.
Yeah, that's a direct quote from a medical expert, and it's exactly why we're getting into this today. The stakes here are super high, and just knowing these signs, that's a really powerful tool to have in your back pocket for your health. All right, so let's play detective for a minute. What are these signals really, and what in the world are they trying to tell us? We're about to uncover all those hidden meanings, one clue at a time. Okay, so our investigation is going to start with one of the most classic signs of iron deficiency, something you can actually see just by looking in the mirror. It all comes down to what's happening deep inside your bloodstream. The official medical term is pilar, and it happens because iron is like the key ingredient for hemoglobin. That's the protein that gives your blood its bright red color and, way more importantly, lets it carry oxygen all over your body. So if you don't have enough iron, your blood literally gets paler. And what's really wild is when you see it up close. On the right, you've got these healthy, happy red blood cells. They're all uniform and full of that rich red color. But then you look to the left, and the iron-deficient cells, they look almost ghostly. They're pale, kind of sad and underfilled, and they can even get warped into these weird shapes like that classic pencil cell you're seeing right there. The cool thing is, you don't need a microscope to spot this. Here's a super quick check you can do right now. Just head to a mirror and gently pull down your lower eyelid. See that inner surface? That's the conjunctiva, and it should be a nice, healthy pink or red. If it's looking pale or even white, well, that's a pretty big clue. And what's awesome is this little test works for every single skin tone. Another spot doctors will check is the palm of your hand. If you stretch your fingers out, those creases in your palm should be a little bit darker than the rest of the skin. If they're about the same color or even lighter, that could be another sign. Just a little heads up though, this one isn't always as reliable if you have a darker complexion. But the clues don't stop there. Oh no. Our investigation now takes us to your hands and your mouth because, believe it or not, your nails and tongue can tell a pretty amazing story about what's going on with your iron levels. Okay, this one is called chylonia, but everyone just calls them spoon nails, and for good reason. There was this one case of a 22-year-old woman who went to the doctor just feeling tired all the time, and they noticed her nails had this really dramatic spoon shape. Sure enough, blood tests showed she had severe iron deficiency. It's just such a crazy physical sign of what's happening inside. But, it's not always super obvious. So here's a neat little test you can try at home. Just put one single drop of water on your nail. If your nail is healthy, it should just roll right off. But if that nail has started to flatten out or get that spoon-like dip, that drop of water will just sit there, pooled right in the middle, just like in a tiny spoon. All right, let's talk about the tongue. If your tongue ever starts looking kind of smooth and polished, there's a name for that: atrophic glossitis. Basically, all those tiny little bumps, the papillae, they start to disappear. And this isn't just about looks. Those bumps are what help you taste things. Without them, some people say food starts to taste bland, or they even get this weird burning feeling. And what about those painful cracks you can get at the corners of your mouth? Well, this is a perfect example of how important iron is for just basic repair. The skin at the corners of your mouth has to be super thin and stretchy, right? So when you're low on iron, your body just can't keep up with the daily wear and tear from talking and eating. The tissue gets weak, it cracks, and you end up with that nasty inflammation called angular cheilitis. So we've covered all the clues you can see with your own two eyes. Now, let's get into the ones you feel. We're talking about bizarre cravings and some really strange physical feelings that can be dead giveaways for low iron. This one has a name. It's called pica. And by far, the most common type is this intense, unstoppable urge to chew ice. It's such a huge red flag that if a doctor sees a patient who just can't stop crunching on ice, checking their iron levels is like the first thing that pops into their head. And trust me, the cravings can get seriously weird. We're talking uncooked pasta, dirt, chalk, cornstarch. The TV show Freaky Eaters had a woman who ate 2 pounds of rocks a day. But it gets even crazier. There was a documented case of a man who slowly ate an entire airplane, piece by piece. The bottom line is, if you suddenly start craving things that aren't food, it is definitely time to get your iron checked. Okay, this one is a biggie. If just walking up a flight of stairs completely winds you, or you just feel wiped out all the time, That is a classic symptom. Remember those pale little red blood cells? They are struggling to deliver oxygen where it needs to go. Your body is basically running on fumes, and your heart might even start racing to try and make up for it by pumping what little it has faster. What about that creepy, crawly feeling, that feeling where you just have to move your legs, especially at night? That's restless leg syndrome, and it has this totally fascinating link to iron. What's incredible is that you can have an iron deficiency specifically in your brain that's causing this, even if your regular blood tests come back in the low normal range. It just goes to show how complex this stuff can be. Okay, so we've run through the common signs, but now we got to talk about why ignoring them can be so risky. Let's dive into some of the more serious, though definitely rare, complications. Now, this might sound kind of shocking, but it's true. So here's how it can happen. Your body, in response to the anemia, can just go into overdrive and start making way too many platelets. Those are the cells that form clots. This makes your blood thicker, stickier, and more likely to form a dangerous clot that could, potentially travel to your brain. After hearing all these clues, the next logical question is, okay, what do I do about it? So let's talk about how you can get some real answers and start taking action. The good news is, getting a diagnosis is usually pretty straightforward. The best place to start is a ferritin test. Think of it like checking the gas tank in your car. It tells you exactly how much iron your body has stored up in reserve. If that level is low, it's a dead giveaway. But it can get a little tricky. Other things, like inflammation, can sometimes make ferritin levels look higher than they are, so a doctor might need a full iron panel to get the complete picture. So once you know you're deficient, the most important question is why? Is it because your body just needs more, like during pregnancy? Is it because you're not getting enough, maybe from a restrictive diet or an absorption problem like celiac disease? Or, and this is the one we talked about at the very beginning, is it from blood loss? That could be something obvious, like heavy periods, but it could also be from hidden bleeding in your GI tract, which can be that crucial early warning sign for colon cancer. Now, whether you're trying to get your levels up through food or supplements, here are 4 really practical tips to get the most bang for your buck. First, always pair your iron with vitamin C. Think bell peppers with your steak or a glass of orange juice. Second, try not to take it at the same time as calcium, tea, or coffee, because they can block it. And here's a fun one. Just cooking your food in a cast iron pan can actually add a little bit of extra iron to your meal. So there you have it. We've decoded the signals, everything from pale eyelids to a crazy craving for ice. The real takeaway here is that your body is always talking to you. So now that you know the language a little better, what secrets is it trying to tell you? If any of this stuff sounded familiar, that's probably a conversation worth having with your doctor.